Hi, my name is Jim Flaherty, and I'm a physical therapist with Atlantic Physical Therapy Center. I think it's important for you to understand a little bit about spine anatomy and how the back moves and works, as well as how the hips move and work. So we're going to spend some time discussing that first. So our spine is not straight up and down like this pen, especially in our lower back. We have a lower back curve, and this is called a lordotic curve. And when we're talking about bending and picking things up off the ground, we actually want to maintain this normal curve position or this neutral spine alignment. Your back consists of vertebrae, and these vertebrae are bones that are stacked up on top of each other. And while there is some movement and your back can bend and twist and rotate, there's not a lot of movement. The joint spaces in our back are very small. So your back can move, but it's not built for a lot of excessive movement. Now let's look down at our hip. Your hip is a round ball, and it's kind of jammed into a big old round socket. And your hip, it can move everywhere. It can rotate, it can come up, it can go out to the side. Your hip is actually built for movement. And it's also surrounded by big, strong muscles in our gluteal region, our buttocks, and our thighs. And those are real powerful muscles, and those are the muscles that we want to utilize when we're bending to pick something up off the ground, rather than utilizing a lot of more smaller muscles, not as strong, in our lower back. So the key tips to remember when you're trying to pick something up is that we want to maintain the neutral spine alignment, or maintain that normal curve in our spine, and we want to move a little bit more through our hips and not just bend at our knees.